I see a lot of different people with different age ranges for knee pain. Predominantly, I see older people being usually over 40 or so, that have knee pain related to osteoarthritis. Osteoarthritis is wearing of the cartilage from the tips of the bone. The femur articulates with the tibia, so the thigh bone articulates with the shin bone. And on the ends of the bones is cartilage. Once the smooth cartilage starts wearing off, that exposes the bone underneath. Unfortunately, the bone underneath has nerves in it, and the nerves can then start becoming stimulated and cause knee pain. We also see people with knee pain related to meniscus pathology. People over 40 start getting degenerative meniscus tears, which occur oftentimes even without trauma. It's pain usually on one side of the joint, more typically medially or on the inside of the joint, but sometimes on the lateral side. Meniscus tears can cause pain at night, similar to osteoarthritis, but it seems to be more localized than osteoarthritis.
Let's talk about the three most common types of knee pain: iliotibial band syndrome, or ITB, runner's knee, or chondromalacia and patellofemoral stress syndrome, and arthritis of the knee.
I'm Tara Polak, physical therapist at Evolution Physical Therapy, here to give you some answers on the anatomy of the knee and how that relates to physical therapy exercises for the knee. Now, the knee is comprised of the top bone, which is the femur, that articulates or makes a joint with the bottom bone, which is the tibia. In between those two bones is the cartilage or the meniscus of the knee. On the top of the knee, we also have a tendon. The quadriceps muscles come down and form the quad tendon and then attach to the end of the tibia via the patellar tendon. Now, enveloped in this tendon is the kneecap or the patella. So if I pull that down, we can see the underside of the patella. That articulates or makes a joint with the groove right here in the femur. Now, the patella has to move up and down the groove as we bend and straighten the knee. Now, it's important for the muscles around the knee, like the quadriceps and the hamstring muscles, to have a balance between their strength and their flexibility so that you maintain good health of your knee joint.
With information about an exciting regenerative medicine clinical research trial to treat knee arthritis. Osteoarthritis, or degenerative joint disease, is a degenerative condition of joints affecting millions of patients. It causes pain and significant functional limitations with subsequent deterioration in quality of life. While we have many treatments, there is no non-surgical cure, and the condition often progresses to the point where joint replacement is required. At Mayo Clinic and the Mayo Center for Regenerative Medicine, we are studying several biologically based non-surgical treatments for osteoarthritis. One such treatment is the harvesting of a patient's own stem cells from their bone marrow. In our procedure, we draw cellular-rich bone marrow from both sides of the pelvis. We then filter the resulting product and concentrate the stem cells and their corresponding growth factors. Using an ultrasound to image the knee joint, we are then able to precisely inject the cells into the arthritic knee. We are currently demonstrating that this procedure is safe and can relieve pain. We also hope to be able to slow the progression of the degenerative joint disease and perhaps even one day regrow cartilage within the arthritic joint.
Before you are taken to the operating room, your anesthesiologist will talk with you about the medications used during the procedure, and he will administer the medications once you are in the operating room. A primary total knee replacement procedure typically takes between 1 to 2 hours to complete. The doctor begins by making an incision extending from the thigh past the inside edge of the kneecap and down to the shin bone. After making the initial incision, the doctor will shape the end of the femur in preparation for sizing the femoral component. In the same way, the top of the tibia is shaped for proper sizing of the tibial component. Next, the provisional or trial units are put in place and the appropriate implant size is confirmed. After the appropriate implant size is selected, the knee is assessed for alignment, stability, and range of motion, and the underside of the kneecap is prepared and the patella trial is selected. Then, the trial units are removed and the final femoral, tibial, and patella components are implanted. The doctor will finish the procedure by closing the incision, implanting a tube to allow drainage, and applying the postoperative bandages. You will be taken to the recovery room. In the recovery room, the staff will monitor your vital signs until you are transferred to your hospital room.
Four exercises to help before and after your knee replacement surgery. First is the leg press, which builds strength. Depending on your ability and pain level, start with 2 to 3 sets of 15. If you are doing well and not experiencing pain in the knee joint, you can work toward performing single leg presses. Next is single leg balance stands. Performing these builds balance and positional awareness. Stand in front of something you can grab if you lose balance, and stand on one foot. Hold for 20 to 30 seconds, making sure you are stable and not wobbly. As you progress, try closing your eyes or standing on something unstable, like a balance trainer ball or foam pad. The third exercise is wall sits, another great way to build strength. Sit up against a wall with your feet far in front of you, so your knees are not over your toes. Hold this position for 20 to 30 seconds at a time, then relax and stand, and repeat. Try 3 to 4 sets of 20 to 30 seconds each. The fourth exercise is called toe taps. They help build both balance and positional awareness. This exercise is sometimes called the clock step because it involves marking the floor around you in a clock-like pattern, with marks at 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock. Marks should be 12 to 16 inches from you when you stand at the center of the circle. Stand on one foot and while balancing, reach the other toe to the floor mark.